Next, history and evolution of health information technology, also referred to as health IT, early beginnings and paper records. The journey of health information technology began long before digital systems were introduced. In the early 20th century, patient information was recorded on paper and stored in files. These paper records were the primary means of capturing and maintaining patient data, though they were often incomplete, fragmented, and difficult to share or analyze. From 1960s to 1970s, the advent of electronic systems. The 1960s marked the beginning of the electronic revolution in healthcare with the introduction of computer systems to manage health data. Some notable developments during this era include computerized physician order entry, also referred to as CPOE. Many hospitals began exploring computerized systems for order entry to reduce errors and streamline processes, though adoption was limited due to high costs and technological constraints. Next, early electronic medical records, also referred to as EMRs. The first iteration of electronic medical records were developed primarily within large hospitals and research institutions. These early EMRs were rudimentary and mainly used for administrative purposes. From 1980s, the emergence of health informatics. During the 1980s, there was a growing interest in health informatics, the interdisciplinary study focusing on the effective use of information in healthcare. Key advancements include standardization efforts. Efforts began to standardize healthcare data to facilitate better sharing and interoperability. Coding systems like ICD, also referred to as International Classification of Diseases, and CPT, also referred to as Current Procedural Terminology, were integral in these efforts. Next, integration of computing in healthcare. With the advent of more affordable computing technologies, healthcare institutions increasingly adapted computerized systems for various applications, including billing and scheduling. 1990s, rise of electronic health records, also referred to as EHRs. In 1990s, this saw significant growth in the adoption and functionality of electronic health records. Key developments include EHR adoption. There was a push towards more comprehensive EHR systems that could integrate clinical, administrative, and financial data supported by both government and private sector initiatives. Next, interdisciplinary collaboration. Health IT began involving multidisciplinary collaboration to improve system design and user interface, aiming for enhanced clinical workflow integration. Next, in 2000s, legislation and technological advancements. The early 2000s marked a landmark period for health IT, driven by legislative changes and technological advancements. Firstly, High Tech Act from 2009. The Health Information Technology for Economic and Clinical Health, also referred to as High Tech Act, was introduced as part of the American Recovery and Reinvestments Act, also referred to as. era, promoting the adoption of EHRs by providing financial incentives and setting meaningful use standards. Next, advancements in IT infrastructure. Advances in networking, storage, and computing power enabled more sophisticated health IT solutions, including cloud based systems and enhanced interoperability technologies. Next, 2010s, widespread adoption and interoperability. The 2010s saw a marked increase in health IT adoption across various components of the healthcare system, characterized by increased EHR penetration. By the end of the decade, most healthcare providers had adopted some form of EHRs. The focus shifted towards improving usability, reducing clinician burnout, and enhancing patient engagement. Next, health information exchanges, also referred to as HIEs. The growth of HIEs facilitated better sharing of information across different healthcare providers, contributing to more coordinated and patient centered care. Next, 2020s, emphasis on innovation and connectivity. The current decade is characterized by rapid innovation and connectivity in health IT, such as telehealth and remote care. The COVID 19 pandemic accelerated the adoption of telehealth technologies, proving critical for delivering healthcare remotely and safely. Next, artificial intelligence and big data. These technologies are increasingly being integrated to analyze large data sets to improve predictive analytics, personalized medicine, and clinical decision making. Next, focus on interoperability. Continuous efforts are being made to address interoperability challenges to create seamless data exchange and integration, enhancing care quality and efficiency. In conclusion, the evolution of health IT is a story of technological ingenuity and an ongoing commitment to improving healthcare delivery. From its early days of paper documentation to today's sophisticated digital systems, Health IT has transformed of how healthcare information is managed, shared, and utilized, ultimately advancing patient care and health outcomes. Understanding this evolution is crucial for anyone entering the health IT and EHR fields, as it informs current practices and future advancements. Thank you.